Have you ever walked out of your doctor's office feeling completely confused and honestly a little defeated? You woke up that morning, laced up your shoes, and walked your neighborhood just like you do every single day. You measured your salt, took every single medication on schedule, drank your water, and did everything your doctor told you to do. And then the nurse wrapped that cuff around your arm, pumped it up, and told you that your blood pressure is still sitting stubbornly at 148/91. And you sat there in that paper gown thinking, what more can I possibly do? If that moment sounds familiar to you, I want you to take a slow, comfortable breath right now, because what I am about to share with you today may be the most important and most relieving explanation you have ever received about your own body. Hello, I am Dr. Claire Vega, and today we are going to have a real, honest, deeply informative conversation about why so many wonderfully health-conscious adults over the age of 65 are still fighting stubborn high blood pressure numbers despite doing absolutely everything right. Before we go further, I want to be clear that this video is for educational purposes only, and I always encourage you to speak openly with your own trusted healthcare provider before making any changes to your personal treatment plan. What we are doing today is looking far beyond the salt shaker, far beyond the standard advice, and going deep into the hidden biology of what is actually happening inside your body as the years go by. Because here is the truth that most 15-minute appointments never have time to explain. There are 4 very specific, very real biological reasons why blood pressure becomes stubborn after age 65, and not one of them is your fault. The first reason is something called arterial stiffness, and I want to explain this in a way that will make complete and immediate sense to you. I want you to picture a brand new rubber garden hose fresh out of the box. The rubber is soft, flexible, and springy. When you turn up the water pressure at the spigot, that new hose expands gently to handle the extra flow without any strain at all. Now picture that exact same garden hose after it has been sitting outside through 60 or 70 summers and winters, baking in the heat and stiffening in the cold. The rubber is no longer soft, it is rigid and unyielding. When you turn up the water pressure now, the hose cannot expand to absorb it. The pressure simply rises because the walls will not flex. This is precisely what happens inside your arteries over the decades. The proteins that give your arterial walls their youthful elasticity naturally change over time. A structural protein called collagen builds up while another called elastin gradually breaks down. The result is that your arteries become progressively less flexible, and your heart has to generate more pressure to push blood through them. This happens even in people who eat beautifully, exercise consistently, and take excellent care of themselves. It is a natural biological process, not a personal failure. But it does mean your cardiovascular system needs smarter, more targeted support than a simple salt restriction can provide. The second reason is one that surprises most people, and I want you to pay close attention here because this one is genuinely hidden. It is called insulin resistance, and it affects a large number of adults over 65, even when their blood sugar is completely normal and their weight is perfectly healthy. Here is how to understand it simply. Insulin is a hormone your pancreas produces to help move the energy from your food out of your bloodstream and into your cells where it can be used. Think of insulin as a traffic officer standing at an intersection, directing cars off the highway and into their proper destinations. As we age, our cells gradually start ignoring that traffic officer. They stop responding to his signals as efficiently as they once did. So your pancreas does the only thing it can. It sends more officers, it produces more and more insulin to get the same job done. And here is where your blood pressure becomes directly affected. When large amounts of insulin are circulating in your bloodstream, 2 things happen simultaneously that drive your pressure upward. Your kidneys receive a hormonal signal to hold onto sodium and retain water rather than flushing it out. And your sympathetic nervous system, which is the biological system responsible for your stress and alert responses, becomes activated, causing your blood vessels to tighten. So even if you are eating a beautifully low sodium diet, your own hormonal chemistry may be quietly trapping sodium inside your body and keeping your vessels constricted from the inside, with absolutely no connection to how much salt you shook onto your dinner plate. The third reason is something I call the late night metabolic trap. And this one is responsible for more frustrating morning blood pressure readings than almost anything else I see in my clinic. Many of us enjoy a small, comforting snack in the evening. A few crackers, a slice of toast, a small bowl of cereal while the evening news plays in the background. It feels harmless and familiar. But here is what is happening biologically when you eat close to bedtime. Your body releases a surge of insulin to process that food. Your blood sugar rises, your system activates, and instead of your blood pressure doing what it is biologically programmed to do overnight, which is take a natural restorative drop of 10 to 20% that allows your heart and vessels to rest and repair. Your body stays metabolically active and pressurized all night long. The energy from that late snack has nowhere productive to go because you are lying completely still. So it circulates in your bloodstream, keeping your insulin elevated, your kidneys retaining fluid, and your pressure stubbornly high from the moment you fall asleep until the moment you sit down in that examination chair the next morning. I had a patient, a 69-year-old retired teacher named Harold, who made absolutely no changes to his diet, his exercise routine, or his medications. The only thing he changed was stopping his evening crackers and closing his kitchen 3 hours before bed. Within 3 weeks, his morning readings had dropped noticeably and consistently, and he called my office genuinely amazed. The fourth reason connects your sleep quality directly to your blood pressure in a way that is powerful, practical, and entirely within your ability to influence. As we grow older, our sleep naturally becomes lighter and more fragmented. You may find yourself waking more frequently during the night, perhaps to use the restroom, or because a stiff hip or shoulder makes it hard to stay comfortable. Every time your sleep is interrupted, your body interprets that disruption as a low-level physical stress. And in response to stress, your body releases a hormone called cortisol. Cortisol is an ancient survival hormone designed to raise your blood pressure, sharpen your senses, and prepare your body for action. When your sleep is fragmented night after night, cortisol levels remain quietly elevated throughout the following day, gently but consistently pushing that top number on your blood pressure reading upward, regardless of how well you ate or how far you walked. Now let me give you 3 specific, simple, and genuinely effective things you can start doing today. The first is to close your kitchen 3 hours before bedtime. If you go to sleep at 10 in the evening, your last food of the day should be by 7. This single change allows your insulin to fall naturally before you sleep, signals your kidneys to release retained sodium, allows your blood vessels to relax, and gives your cardiovascular system the overnight rest it needs to repair and recover. Start with this one change before anything else. The second is to take a gentle 10 to 15 minute walk immediately after your largest meal of the day, not before, not an hour later, immediately after. When your leg muscles are gently active right after eating, they absorb the energy from your food directly and efficiently, dramatically reducing the size of the insulin surge your pancreas needs to produce. You do not need to walk fast. A casual, comfortable stroll around the block, or even a gentle pace through your living room if the weather is keeping you inside, works beautifully as a natural pressure release valve for your entire cardiovascular system. The third is to manage your cortisol deliberately every single morning before your feet touch the floor. Because cortisol is naturally at its highest point of the entire day within the first 30 minutes of waking, the way you begin your morning has a direct and measurable effect on your blood pressure for the hours that follow. Before you reach for your phone, before you turn on the news, before you begin mentally running through your to-do list, I want you to take 3 slow, deliberate, intentional breaths. Breathe in through your nose for a count of 4, let your belly rise fully, and breathe out gently through your mouth for a count of 6. This practice takes less than 60 seconds and sends an immediate, powerful signal to your nervous system that you are safe, that there is no emergency, and that your blood vessels can remain relaxed and open as your day begins. Your body has carried you faithfully through decades of a rich and full life, and it deserves to be understood rather than simply medicated. Please take everything we talked about today and bring it into an open, honest conversation with your physician. Ask about arterial stiffness. Ask about insulin resistance. Ask whether your morning readings might be connected to your sleep quality or your evening eating habits. The more specific and informed the conversation, the better the partnership and the better the outcomes. If this video gave you clarity, comfort, or even one new idea to try, please subscribe to this channel so we can keep learning together every week. And I would genuinely love to hear from you in the comments below. Have you been struggling with stubborn numbers despite doing everything right? Have you tried adjusting when you eat or how you start your morning? Share your story. This community grows stronger every time one of us speaks honestly about what we are experiencing. Thank you so much for being here today. Be well, be patient with yourself, and I will see you in the next video.